menopause is the last or the final menstrual period. Okay, so remember that menarche or puberty, menarche is the first period, menarche. It's the first period. Menopause is the last period, the final period. And it's a retrospective diagnosis. That means you have to go 12 months without a period before you're labeled postmenopausal, because you may stop. What happens is that the time leading up to the period, menopause, which is known as peri-menopause. So it's the time that surrounds menopause as you're approaching menopause. That tends to be anywhere between 2 to 8 years, an average of 4 years. So the average per woman all over the world tends to stop her periods around the age of 51, with a range between 45 and 55 years. She can expect to stop her periods. Okay? There will be some outliers beyond the age of 55, but most people will stop their periods between 45 and 55. And when they stop their period, they don't know that they're definitely menopausal yet, because they have to wait a whole year to be then told you are now menopausal, or now you're in the post-menopausal phase. You never finish with menopause. You're always going to be, and the current life expectancy in the Western world is around 83 years. In Hong Kong and other places, it's 88 years. In the US, it's a bit lower. But whatever it is, that's 30 years that you're going to spend in this very important phase of life, when you often have less financial worries, and your children have, if you have children, your children have grown up and gone away. You have time for yourself. So actually, if you then just think, oh, I'm getting old and I'm going to die soon, that's the wrong way of looking at it, because dementia is the biggest killer of women now in the Western world, especially in the UK. It's the top killer in the UK. So menopause is your final menstrual period. The average age is 51 when you stop your periods, and the range is between 45 and 55. And the time that is leading up to the menopause is known as peri-menopause, and is usually around the age of 47, because it's about 4 years before you stop your periods. And what happens in peri-menopause is that you may notice that your periods are getting a little bit more closer together, or they're getting a bit further apart. So you may have a period in January, nothing in Feb, nothing in March. Then you may have periods in May, June, July, then nothing again. And so it stops and starts, and you keep thinking, oh, have I gone through the menopause? No, got to wait 12 months to call yourself menopausal or postmenopausal. But during this peri-menopause time, you may have hot flushes, lowered mood changes, lower libido, less desire for sex. You may have night sweats. Your periods may get a bit heavier. Your periods may get a bit lighter. All these symptoms can occur, and they can last anywhere between 2 to 8 years, average of 4 years. So a 51-year-old woman would expect to start going through the change, as they say, around the age of 47. And then you have a group of women, myself included, that are 1 in 10,000 women will stop their periods. 1 in 100 women will stop their periods under the age of 40. And that is known as premature. It used to be known as premature menopause, but it's actually premature ovarian insufficiency. The number of eggs in your ovaries have dropped to a critical level, and that's when menopause occurs. But when it occurs under the age of 40, it needs specialist input, gynaecologist, somebody with a special interest like myself to look after those women. They need tests and things like that. They need hormone replacement unless there's a real contraindication. So that is really important. Under the age of 40, some women may not even have started their fertility journey. So you can imagine. Yes.
Oh, yeah. Quick question. When a woman starts with perimenopause, is that typically when the symptoms occur? And once a lady has gone through 12 months with no period, is that suddenly the symptoms stop, or is it something that can go on?
No.
It's very case specific.
Yes, it can go on. About 10% or 12% of women will still have hot flushes about 10, 15, 20 years down the line.
20 years.
It's important to understand that there are different symptoms at different times. So, for example, vaginal dryness that can cause painful sex is not really seen in the first 6 years of stopping your periods. It's generally seen more common in the second half, 6 years after you stopped your periods, and can get worse over time. Similarly, your sleep can be really disturbed in the perimenopause and in the menopause time. And then over time, it can get better as you adjust things in more, when your hormone levels are not fluctuating as much and they've stabilized to a high level, but they're not fluctuating that much and your estrogen levels are dropping. So symptoms can last, and then so symptoms like hot flushes, mood swings, night sweats, they usually last, around 3-4 years after you stop your periods, and also during perimenopause. And most women will stop having these symptoms and will start having other symptoms such as vaginal dryness, urinary problems, needing to go more frequently, cystitis-like symptoms where they feel they need to go every few minutes, and when they go, there's not a lot of urine. The urine infections are not there. So they may have bowel upsets as well. There are about 34 different symptoms of menopause. Tingling in your arm, under your skin, tingling in your ears, all kinds of symptoms. And then later on, you may have increased risks of heart disease, osteoporosis, as well as dementia. So, we discuss all these symptoms and details of it in the course, because I want women to understand that it's not like you stop your periods and that's it, you're done with the menopause. No, because then you'll be doing yourself a disservice if you actually haven't spent time understanding why you're having these symptoms, what can you do, and when should you start. It's never too early to start making lifestyle changes so that you can actually improve how you approach the menopause. And it's never too late. You could be 60 and you can still bring in those changes.